I have some bad news, everyone. Scientists in Australia have recently announced that a superbug is sweeping through hospitals across the world, causing severe infections and, in some cases, death. As a superbug, the traditional drugs used to treat it don't work anymore, as it's evolved resistance to them. The superbug is the Staphylococcus epidermidis, which is related to the MRSA bacteria. It turns out that the Staphylococcus bacteria lives on our skin, and it makes it into our bodies when we have surgery, or insert catheters, or do something that brings external stuff inside the body. Typically, Staphylococcus epidermidis infects the elderly and other people who are already bedridden and sick, making it a kind of microbial grim reaper, so to speak, coming to seal the deal for anyone who's vulnerable. It's feared that this bug is spreading rapidly through intensive care wards, because people there are the sickest, and antibiotics are heavily used. It's a prime environment for breeding antibiotic-resistant superbugs. In studying the superbug, the Australian scientists found that S. epidermidis was part of a lineage that had evolved resistance to the drug rifampicin. They also found that it had other mutations that conferred resistance to vancomycin and teicoplanin, which are two glycopeptide antibiotics widely considered to be the last line of defense, so to speak. These drugs are what they give you when nothing else works, and now this cousin of MRSA has evolved resistance to both of them, on top of having pre-existing resistance to a so-called first line of defense drug. The authors say, and I quote, "Our study has uncovered the previously unrecognized international spread of a near pan-drug resistant opportunistic pathogen, identifiable by a rifampicin-resistant phenotype. It is possible that hospital practices, such as antibiotic monotherapy utilizing rifampicin-impregnated medical devices, have driven the evolution of this organism, once trivialized as a contaminant, towards potentially incurable infections." Unquote. This news comes on the heels of an earlier study that examined a strain of bacteria that had become resistant to alcohol, which is really scary, because alcohol's mechanism of action for killing bacteria was thought to be so overwhelming that it was impossible for bacteria to evolve resistance against it. But this turns out to be not true. This is an assumption that we can't make about anything anymore, and we really have to start regulating our use of antibiotics before we end up creating the next Black Death or Spanish flu right here in our hospitals. Except this time, they'll be totally resistant to all the drugs that we use to treat them, and we'll be totally defenseless.